Hi everyone. So I'm documenting this health issue that's going on with my cat, Princess. It's been going on for about 13 days. And the conclusion that we have as of today is that she may have suffered a stroke. And there are several videos that I viewed of others whose cats have also suffered a stroke. And there isn't a lot of information out there on, the prognosis for strokes. And there isn't any real formal treatment for cats recovering from strokes. So I decided to go ahead and document this video. And I'll give you a brief overview of what's happened in the last 13 days. So Princess, I estimate her age to be around 11 years old. I adopted her when she was about 4 years old. And she is a Siamese mix. She looks Siamese, but she has these greenish gray blue eyes. So she's got some kind of a mix in her. And so the first night, the first thing I noticed was a brief episode where she was walking in a tight circle on the bed. And at that time, she also appeared to not have any vision. And it lasted about 15 or 20 minutes, and then it subsided, and her vision was fine, her reflexes were fine, and I was relieved. The next day, her behavior was completely normal. Her appetite was normal. She would go in her normal sleeping spots. All was fine. And then that second night, she had another one of those episodes where she was walking in tight circles on the bed, and her vision seemed to be affected. And again, it subsided after maybe 10 or 15 minutes. The next day, her behavior was normal. Normal appetite, using the litter box, sleeping in her normal spots. And then the third night, she had another one of those episodes. When I woke up the next morning, I noticed that she was having some balance problems when she was walking. And I also noticed that she was having some problems with her front left paw. She might have been walking over an object, and she cleared it fine with her right front paw, but she didn't with her left front paw. And at that time, she also appeared to be having some issues with her left hind leg. I already had an appointment scheduled with the vet to take her to be examined, so I took her to the vet. Princess has really bad allergies. She always has had bad allergies, and so she gets a wax buildup in her ears. So I thought maybe the wax buildup might have been creating an issue with her balance and possibly her vision. So the vet cleaned her ears out. They did notice a little bit of an infection in her ears, so they prescribed her some clindamycin and prescribed her some ear drops. And at that point, they sent me on my way. The next day, I noticed some progression with an issue with this paw, and it concerned me. So I took her to a different vet because the vet I had seen the day before wasn't available, and the treatment at that vet place was limited. So I took her to the second vet. They did an evaluation on her. They noted that she seemed to have no vision in her left eye because she didn't really respond to the reflex test that they do to see if they have any kind of response in the eye. And I imagine they may have done that with the pupils too, but I'm not sure. And so that was concerning, that she didn't really have vision in her left eye. And we weren't really certain what level of vision she had in her right eye. They did an x-ray, a full body x-ray. They didn't note any type of indication of brain lesions or any indication of a possible tumor in her brain, and the rest of her body looked fine. So the only thing that the second vet did was prescribe prednisone. So at that point, I was giving Princess clindamycin twice a day, 1.8 milliliters. And I was giving her prednisone twice a day, 0.2 milliliters. And the ear drops that she had, I was administering 4 drops in each ear twice a day. So a few days later, I noticed some improvement. There are things that she does in her routine that tell me that she's feeling good. And one is the trackball scratcher that I have in the living room. And normally, after she would eat a meal, she would go over to the trackball and she would scratch her paws on the trackball. And she wasn't able to do that with both paws, but she did it with her right paw, which I thought was pretty cool. And she also was purring. So, and it wasn't a I don't feel well purr, it was a good purr. So I felt pretty good about that. Several days later, I noticed her poo was runny from the antibiotic. So I called the vet. The vet prescribed a probiotic. It was in two different forms. One was a paste that you gave her twice a day, 1 milliliter, until she formed a stool. And then the other was a capsule that you could mix in with her food, and that was more of a maintenance type of probiotic. The probiotic caused a lot of gas, and so a couple of days after I started giving her the probiotic, which that was just 3 days ago, she started having a lot of discomfort with gas, and it was making her throw up. It was making her appetite decrease, and I was giving her a lot of medications at that point, and it was just a lot for her body to take. So the other things that I noticed earlier this week was that she was walking in circles more. And I don't know if that was because she couldn't see very well and she was kind of mapping out her environment, or if it was something stroke related. The other thing I noticed, which concerned me, was that she would go to drink water and her head would kind of drift off to the left. And so she wasn't getting any water, and that really concerned me. So I made a decision yesterday to discontinue the clindamycin. She'd had it for 10 days at that point, and I really think it was making her miserable, and I certainly wasn't seeing an improvement in her behavior, so I just took her off of it. I also took her off of the probiotic because that seemed to be doing more harm than good. And so at this time, the only medication that I'm giving her is the prednisone, 0.2 milliliters once a day. I spoke with the vet today, and the vet has concluded that it's likely that she had a stroke. And even though you might read on the internet that strokes come on very abruptly with cats, apparently that's not the case all the time. So I don't know if cats have mini strokes, but she may have had like mini episodes for several days, and then there was a stroke that was more visible as far as how it affected her. We didn't do an MRI because the question was, okay, if we do an MRI and they notice brain lesions, then they can confirm that she had a stroke, but how can they treat her? Well, you can assume that a cat had a stroke based on how it's behaving and not go through the MRI. So also the treatment is limited for strokes. So MRI really was seen as an unnecessary expense. Also, if she had a brain tumor, okay, we're talking surgery. And would she survive the surgery? And given the condition that she appeared to be in yesterday, I would seriously question if she would make it through the surgery. The other reason I decided against the MRI is because she would need to be sedated in order to have the MRI done, and I do have a concern for her coming out of the sedation. So, with the conclusion that she likely had a stroke, I decided to start to document her progress, and I'm hoping that I'll see some improvement. I have read a few articles about strokes where sometimes you need to give 2 to 3 weeks to see an improvement in symptoms. I would be elated if she had any kind of vision improvement, and if her left front paw, became stronger. I would be thrilled with that, because at this point she can't jump. So, You know, that's a difficulty I face in, putting her somewhere like where she's at on a bed right now and knowing when she wants down so I can actually put her down myself instead of having her jump down, because I don't want her to injure herself anymore. So that's something I struggle with right now. But I'm hopeful that maybe at some point in the future she'll be able to jump again. So I'm going to continue to do some research on doing some massage and maybe some kind of movement activity that might be therapeutic to help that front paw, and we'll see what happens. I was pretty upset earlier after speaking with the vet. I just kind of felt a sense of impending doom and that I would need to have her euthanized, but I have read some encouraging stories on the internet, and I'm also looking at her activity and deciding that she's okay with how she is right now. Her appetite is normal. She's drinking water like she should. She's able to use the litter box, and she wants in her usual napping spots. So based on all of those things, I see a will for her to live, to want to live. And so I'm going to do whatever I can to support that. And I'm sure that if the time comes where she doesn't want to continue this way, I'll notice it by changes in her behavior, like her appetite fading and things like that. I will say, since I took her off the medications yesterday, she's seemed much more alert today, and she seems pretty comfortable, and she doesn't seem to be in any kind of pain. So that's my video for today. It's January 29th, and this is day 13 of her issues that likely were a stroke. So I'll keep you posted and monitor her progress whenever I can. If I'm able to get some quick shots in of some encouraging activity that she's doing, I will definitely capture those on video and post them. Otherwise, I may just do kind of a daily briefing of my observations. So right now, my message to anybody else that might be experiencing this is to stay positive and really notice your cat's behaviors and what she's able to do. And I do think that they have a way of letting you know if they get to a point where it's just really too much for them. So I'm hopeful for her, and I do hope she doesn't have any other strokes, and we will see what happens. All right, I'll talk to y'all later.